Our life's work is helping you protect yours. Copic's medical liability insurance delivers more than just a standard policy. Our physician-led leadership team supports and protects physicians, APPs, and medical facilities with expertise developed from decades of experience, CME-accredited education, and 24/7 hotline support from a physician. COPIC.com. We're Copic, here for the humans of healthcare, here for you.
Really, it comes down to the initial size of the tariffs it was mind-blowing. The initial size of the tariffs that were quoted would have made some business lines that we're involved in unsustainable. We would have had to exit them completely.
Welcome to Off the Chart, a business and medicine podcast featuring lively and informative conversations with healthcare experts, opinion leaders, and practicing physicians about the challenges facing doctors and medical practices. My name is Austin Littrell. I'm the Associate Editor of Medical Economics, and I'd like to thank you for joining us today. In today's episode, Medical Economics Managing Editor Todd Shryock sat down with Casey Hite, CEO of Aeroflow Health. They discuss how tariffs on medical devices and components have reshaped the economics of manufacturing and supply chains, and what that means for physician practices already operating on tight margins. Casey Hite, thank you again for joining us, and now let's get into the episode.
I'm Todd Shryock with Medical Economics, and I'm here with Casey Hite, CEO of medical equipment provider Aeroflow Health, to talk about tariffs in the medical device industry. Casey, thanks for joining me.
Thank you. Thanks for having me.
So, Casey, when tariffs on medical devices were first announced, what were the biggest concerns within the industry?
The primary concern, certainly at Aeroflow, is access to care, right? And so whether or not we would be able to sustain the impact to our margins enough, to continue providing the products and services we provide. As you know, we don't have I don't want to say the luxury, but we don't have the ability to pass those additional costs off to our consumers because 90+% of our revenue is paid through third-party payers, health insurers primarily, and those rates are set in the contracts that are negotiated well in advance and are in place for several years.
Were there certain segments of the medical device market that were expected to be hit hardest by the tariffs, and why that segment?
Yes, the primary segments hit hardest by tariffs are the ones where the products are manufactured, obviously overseas, but primarily soft goods, things like, at least in our business, breastfeeding supplies. A lot of that is manufactured overseas. And, at a minimum, even with the electronic medical equipment, the components that go into those devices, they might be assembled here in the US, but those components and raw materials are overseas.
So early on, there was a lot of fear because there were so many unknowns. Looking back now, how closely did those initial fears match what actually happened in the market?
Sure. Well, one thing I think we've all learned is that the initial announcement of tariffs and the size of the tariffs is rarely, if ever, what actually goes into effect. So, so that's one. Really, it comes down to the initial size of the tariffs it was mind-blowing. The initial size of the tariffs that were quoted would have made some business lines that we're involved in unsustainable. We would have had to exit them completely. Luckily, the amount or the size of those tariffs decreased with time.
So what have been the most measurable real-world effects of tariffs on medical devices?
So for physicians, hospitals, et cetera, the most, they're already dealing with constrained profit margins, just like companies like Aeroflow are as well. So it is preventing access in some instances, certainly to get soft goods. Say if you're at a physician's office, things like syringes, personal protective equipment. Those things are more expensive, so it's really causing those types of organizations to look for savings in other areas. So I would say, an unintended consequence of tariffs, and something that Aeroflow has certainly embraced, is the urgency and the innovation that we've always focused on. So we've doubled down, and I'd say tripled down, and really created a crisis within the organization, but took it as an opportunity to rally our staff around this crisis and innovate faster and really empower all levels of the organization to find ways to be more efficient so that we can continue to provide access to these products and services that people really need.
When you talk to others in the industry, are you hearing the same types of adaptations that they're having to do that you guys did?
A lot of folks in the industry are focusing primarily on the tariffs themselves and trying to address tariffs by lobbying the government, really working with the manufacturers to try to lower costs. Some are handling them similar to Aeroflow, where we said, okay, yes, on one hand, we're going to address this with our manufacturers and look for opportunities to lower cost, but we're going to look the opposite direction, see how can we take this and how can we leverage technology and AI to drive more efficiency to make up those lost margins indirectly.
So let's talk about AI for a minute. Like specifically, how have you used AI? What have you heard others doing as far as device companies using it to respond to some of these tariff pressures?
First off, when we think about AI at Aeroflow, we look at technology and we look at AI as a force multiplier. We see it as a way, obviously, to increase productivity, reduce costs. But I think this is one of those rare situations where you can have your cake and eat it too. Because the more you embrace technology, not only do you reduce cost, but we find opportunities to improve our service levels, increase the speed with which we respond to incoming inquiries. So it is, again, one of those rare opportunities where it's not just about lowering costs. Really, every time we find more ways to boost productivity, we increase the level of service and certainly speed up the response times that we have with our customers. And so, but along your question, some of those specific areas. One very simple, well, first off, I think a lot of companies or a lot of folks miss a very simple point as it relates to AI. Just the simple productivity that is gained by using a large language model to perform a search on the net or the internet to find answers to your questions is boost productivity. It's hard to measure, but just that very simple approach of putting these tools in your employees' hands is going to help boost productivity. But some more of the innovative things that Aeroflow is doing is ultimately we're trying to reduce our reliance on fax machines. A lot of folks that aren't in the healthcare industry, don't realize that, doctors communicate with each other with fax. Medical offices, fax is the primary means of communication. So what we've done is we've partnered with companies like Particle Health and Redox so that we can set up data pipelines between us and the physician's EMR system. So again, that we're communicating directly. One of the real advantages of that is we are able to extract the medical records we need to prove medical necessity to folks' insurance companies directly from the physician's EMR systems. So that's not only, increasing Aeroflow's efficiency and productivity, but it's also decreasing the amount of labor that physicians and healthcare offices need to expend to respond to those requests. Some other examples, automating our medical record interpretations and extracting data from them. So typically, when you're a company like Aeroflow, when you need to prove medical necessity for a patient or to review their medical documents in order to determine whether or not they qualify based off of their insurance requirements, when you send a request to the physician's office, the easiest thing for them to do is to send you the entire patient's chart, right? And that can be hundreds and hundreds, thousands of pages. So in those cases, we're using AI now to extract specific elements out of that data and putting that in front of our people so that they don't have to parse through hundreds of pages of notes. That's where we're at today, but we're not far off from being able to actually use these AI agents to interpret that extracted information and essentially say, okay, yeah, this person meets insurance requirements or this person doesn't. Obviously, we're not going to be able to do that in 100% of the cases, but we're targeting about 15% of our interpretation of these documents to be done in a fully automated way by the end of this year. I mean, so one of the obvious ones is implementing AI agents to respond to incoming inquiries that come in via email, chat, or even on the phone. A lot of those simple inquiries related to, say, tracking information or a ship date or straightforward questions can be answered directly by an AI agent. We're already using those agents to respond to chats and emails, and we're very close to having them answer the phone. I think something that's very important to point out when you're talking about this subject, though, is it's really important that these agents are able to measure customer sentiment in real time so that you don't ruin your service levels or the experience that your customers are having. You need to be able to measure the person's sentiment in real time via chat or via phone to say, hey, we're hitting a dead end here. We need to get this to a live agent quickly. I mean, that is crucial to make sure that is real time and you get it to them quickly, because everybody's experienced being stuck in an infinite loop and getting boilerplate answers to questions that can't be answered with a boilerplate, right? And so measuring you have to be very strategic about how you implement these tools. If you don't do it right, you're going to destroy your service level, arguably you can destroy your organization. You really got to be strategic in how you implement it, and always don't put cost savings above the service that you provide your people. Another straightforward, and this is one you hear about on the news a lot, is putting the AI tools in our our application developers' hands. Things like Claude AI has been a great tool for our folks. A lot of the tasks that a computer engineer historically had to do manually can now, especially the simple tasks, can be done by AI tools. I wouldn't say formally trained as a computer developer, but I've taught myself through the years. And in the early days of Aeroflow as an organization, I wrote a lot of our applications myself. And I've started using these tools from time to time, not in my CEO capacity, right? But really it's fun for me, right? And I'm shocked and amazed at how far you can take one of these tools to really knock out, I'd say, 20-30% of that initial workload that you have as a computer developer.
Hey there, Keith Reynolds here, and welcome to the P2 Management Minute. In just 60 seconds, we deliver proven, real-world tactics you can plug into your practice today, whether that means speeding up check-in, lifting staff morale, or nudging patient satisfaction north. No theory, no fluff, just the kind of guidance that fits between appointments and moves the needle before lunch. But the best ideas don't all come from our newsroom. They come from you. Got a clever workflow hack, an employee engagement win, or a lesson learned the hard way? I want to feature it. Shoot me an email at kreynolds@mjhlifesciences.com with your topic, a quick outline, or even a smartphone clip. We'll handle the rest and get your insights in front of your peers nationwide. Let's make every minute count together. Thanks for watching, and I'll see you in the next P2 Management Minute.
It's pretty amazing how AI has moved from, wow, this is really neat, to it is ingrained in everybody's workflow. It's been a very rapid adaptation, it seems like.
Yeah, it has, but there's I'm sure you've read the articles. There's a lot of talk about, companies are talking about this, CEOs are talking about this across the nation, but they're not actually seeing the efficiencies gained through AI, or implementation is flawed. It's taking them forever to roll it out. You have to be cautious with it. We found that, if you have large meetings discussing these types of things and you're trying to develop these tools with large groups of people, things just move slower. And there's also, there's a lot of competing incentives. But one of the hurdles we had to get our people over is, listen, this is going to enhance you at this organization. It's not something to compete with. But I'll be honest, even, at first, when I first started using these tools in the computer, looking at computer applications or to develop computer applications, I thought to myself, I said, God, what am I needed for? You have to talk to that ego, because at first it was like, I'm not so special anymore, right? But I think if you let the dust settle and you think about that a little bit and you say, oh, ultimately, we're going to make decisions, certainly at Aeroflow, that are in the best interest of the organization and not the individual. But I'll be the first to say that when I initially saw these things, it hit my ego a little bit.
So have tariffs had any unexpected or counterintuitive effects on innovation in medical devices?
I mean, I think the counterintuitive, and some might argue intuitive effect of tariffs is it's increased the urgency that companies innovate, because we have to find other ways to boost productivity. So tariffs have certainly had that effect. And I think we're seeing the effect of AI and technology in the labor markets today. It's not, you can't directly attribute it to the number of job openings that are out there or the number of new positions that are being hired for, but it's there, and I think it's going to be a slippery slope, and we're going to see more and more where companies are not going to hire as much, and I'd say that is definitely an effect of tariffs, right? The uncertainty produced by tariffs, number one, is going to make folks hesitate to bring on new positions. But even just the fact, no matter what, tariffs are not going away. I think, we have to accept it. This is the reality. It's not going away. You're going to be paying more for, your cost of goods are going to go up. So, you've got to find ways to innovate. So, I think that's so, one, tariffs have helped accelerate the, folks embracing AI and technology. But at the same time, they will with time, probably, depress the labor market. We're really, companies are going to have to invest in their people and retrain them and teach them new skills.
Early on, there was a lot of talk about how basically every level of the supply chain was kind of eating a certain percentage of the tariff to prevent the big, massive price increase. From your perspective, has that gone away? Are you seeing prices increase as companies are less willing to eat the tariffs and pass it on to the customer?
We haven't seen that, but you're right. So a decent, I wouldn't say a huge percentage, but a decent percentage of the increased cost of tariffs are being shouldered by the manufacturers. A good comparison is not directly to manufacturers, but just tariffs in general and the impact on our organization. 2024 compared to 2025, our cost of goods have increased 15%, and that's across the board. So, have we been able to find 15% in savings outside of our cost of goods? No, right? So, it's not just the manufacturers that are shouldering that additional cost. It's also companies like Aeroflow.
So from your perspective, what lessons has the medical device industry learned from navigating tariffs?
I think one is you've got to diversify your product line. You've got to diversify your product line, and you have to diversify the sources that your supply chain relies on, right? It can't just be concentrated in one country. You need to be across multiple countries to mitigate a spike in tariffs in one specific country. So we really put an emphasis on finding manufacturers or sources of the materials we need in countries, say, other than China, right? And getting outside the box and really diversifying the sources that we access, via our supply line.
So looking ahead, how should physicians and healthcare leaders think about tariffs, technology, and AI as ongoing factors in device availability and cost?
I don't know what the psychology behind this is, but for whatever reason within the healthcare industry, there's always a sort of a doom and gloom culture, right? And it's often less about the opportunities that are present and more about protecting what's already there. It's one of the reasons why the fee-for-service payment model in U.S. healthcare is still in place. Everybody agrees it's not the right path forward, but nobody's willing to let it go, right? People in healthcare, they typically, physicians, hospitals across the board, they want to protect what they have and really see the opportunities that exist. My recommendation would be to look at this from a different lens and look for opportunities to rally your staff around this crisis and motivate them to find ways to boost productivity and embrace technology. Look at change. We look at every change in Aeroflow as an opportunity. So I would suggest that other folks in the healthcare industry accept where we're at. It's not going away, and find opportunities to make up those lost margins and to continue to provide patients with the access to care.
Is there anything else about tariffs that you would like to talk about that we haven't mentioned?
This isn't a political issue for Aeroflow at all, but I would say that I think in cases of national security, tariffs can be an effective tool to boost leverage against somebody that doesn't have the U.S.'s best interest at heart. I think it is that. I think we can all agree on that. So that's not to say that we love tariffs here. I mean, quite the contrary, right? But we have found the opportunities to rally our staff and really embrace change and boost productivity and implement a lot like COVID. I mean, there are a lot of parallels here with COVID, right? The technology to have a meeting like we're having today existed way before COVID. Nobody really embraced that technology until COVID forced us to do it. I see that the parallels there are very similar to tariffs. Tariffs have shook things up and have really accelerated companies and people embracing technology that had already existed. So it's really just, it's acted to speed things up.
Very good. Casey, thanks for joining me today.
No, thank you. I appreciate it.
Once again, that was Casey Hite, CEO of Aeroflow Health, speaking with Medical Economics Managing Editor Todd Shryock. On behalf of the whole Medical Economics and Physicians Practice teams, I'd like to thank you for listening to the show and ask that you please subscribe so you don't miss the next episode. As always, be sure to check back on Monday and Thursday mornings for the latest conversations with experts sharing strategies, stories, and solutions for your practice. You can find us by searching Off the Chart wherever you get your podcasts. And if you'd like the best stories that Medical Economics and Physicians Practice publish delivered straight to your email 6 days of the week, subscribe to our newsletters at medicaleconomics.com and physicianspractice.com. Off the Chart, a business and medicine podcast, is executive produced by Chris Mazzolini and Keith Reynolds and produced by Austin Littrell. Medical Economics and Physicians Practice are both members of the MJH Life Sciences family. Thank you.